Welcome back, everyone, from your break. I hope you're ready for another very good session. I'm delighted to welcome you to this session entitled Sustainable Health for People and Planet, Joining Forces for Global Transformative Action to Tackle Environmental Health Challenges. And for those that participated in the last session, if you need any more motivation to be able to tackle this issue, I'm not sure what else we can say to see how important this crisis is. My name is David Humphreys. I'm the Global Head of Health for Economist Impact, and I have the pleasure of moderating today's session. We're going to build upon the past sessions and really talk about action. Action and understanding the full scale of the health issues and implications that come from climate change, environmental health, and more importantly, aligning and driving impactful, collaborative, and measurable efforts to combat this. I believe strongly that health can be a uniting force as we strive towards climate justice, in meeting the numerous challenges that we face in society, and generating significant positive impacts from our efforts. And of course, as people have mentioned before, putting that human face today and tomorrow and for the future of our children and youth. With this in mind, we're going to talk about three core areas when we're related to action. The first is elevating health and well-being as part and integrated as in that agenda, that common narrative, and how important that is in ensuring that's aligned with action that we're all taking. The second piece are the roles of different stakeholders, and I'm glad that we're going to have a diverse set of people from different backgrounds and different parts of the world to hear coming together and hopefully share some good models and examples of what is already happening to combat this issue moving forward, and elevate issues, including communities, that are a critical part of this narrative. The last piece, maybe the most important piece, is the issue of equity, and all actors prioritizing measurable health equity for those most impacted, and again, for those that we leave this world to. To start us off, I'm delighted to welcome to the stage Minister Steffi Lemke, who is from the Federal Ministry for Environment, Nature Conservation, Nuclear Safety, and Consumer Protection here in Germany. She's going to help set the stage for our panel discussion with her experiences in moving climate change and environmental health to the center of the agenda. Minister Lemke, please.
Excellencies, ladies and gentlemen, I'm very pleased to speak here at the World Health Summit as the German Environment Minister for the second time. It reflects the interdependence between human health and environmental health. There is growing awareness worldwide of this connection. The impacts of the triple planetary crisis of climate change, biodiversity loss, and pollution are affecting both humans and the environment. This is especially true when it comes to the climate crisis. Its impacts on health are already felt all over the world, with heat waves, water scarcity, and the spread of infectious diseases. This is why climate action always protects health too. And this will also be clear at the UN Climate Conference. Health ministers will meet at the conference for the first time for a health day. Also, in other areas, such as food and mobility, climate change mitigation, and health promotion go hand in hand. This is why my ministry supports integrated, holistic approaches like One Health and Planetary Health. The priorities should be the precautionary principle and prevention. This helps us avoid costs for medical treatments. The COVID-19 pandemic starkly illustrated this, which leads me to the second planetary crisis, global biodiversity loss. COVID-19 heightened our awareness of the importance of environmental health and biodiversity to prevent epidemics and pandemics. To highlight this link, Germany launched the Nature for Health Trust Fund in collaboration with leading international organizations. The goal of this initiative is to prevent zoonoses at the source. It supports projects that stop the transmission of diseases from animal to humans, covering all activities that bring humans, livestock, and wild animals into close contact. My ministry has provided startup finance of 50 million euros, enabling partnerships in at least 15 zoonosis hotspots. There are also close links between health protection and the third planetary crisis, pollution. These links were the focus of recent international negotiations. At the fifth session of the International Conference on Chemicals Management in Bonn at the end of September, we adopted the global framework on chemicals. 1.5 million lives are lost per year due to lead poisoning. Children's brain development is impaired massively. The new global framework agreed in Bonn will strengthen cooperation between all stakeholders for improved chemical safety. We reached agreement on progressive targets and effective steps for the safe management of chemicals globally. This benefits both people and the environment. The production of chemicals is increasing rapidly, and if they are not managed properly, chemicals can also pose a threat to public health, such as the lead poisoning I already mentioned. At the International Conference of Chemicals Management, agreement was reached between governments, industry, civil society, and the scientific community in all sectors dealing with chemicals and waste. Representatives of health production and occupational health, environmental protection, industry and trade, agriculture, energy and transport were involved, and Germany will provide 20 million euros to kickstart the implementation of chemical management, especially in the global south. This is the right approach to ensure benefits for both the environment and health. Wish you a success conference, and thank you.
Thank you, Minister Lemke, for taking the time and sharing those wonderful examples of how we can really take an integrated approach to the challenge that we're facing here moving forward. Now I want to be able to introduce our panelists and hopefully generate a productive dialogue as we talk about action. I'd like to welcome to the stage Dr. Victor Zhao, the President of the U.S. National Academy of Medicine, Dr. Eto Leonor Noia Maciel, the Secretary of Health, Surveillance, Environment, and the Ministry of Health in Brazil, Dr. Alan Dangor, Director of Climate and Health at the Wellcome Trust, and wonderfully again, Dr. Maria Neira, Director of the Department of Environment, Climate Change, and Health at the WHO. And last but not least, Dr. Garth Graham, Head of YouTube Health. All right. Let's go ahead and sit and get comfortable for the time that you are here. Everybody, we can see that we have a wonderful and diverse panel from different backgrounds. And I'm delighted to be able to jump in right into this. And the first piece we want to talk about, very briefly but importantly, is integrating health into the environmental health discourse. This is something, talking to my colleagues, economists impacted our focus, sustainability, that they see the movement from their end, that health has become a greater voice, and the things that they go and talk about in energies in the cities and communities and the like. At the same time, the previous panel talk about the gaps that we face. And I want to be able to address those gaps and how we're able to elevate this and come with a common narrative. And Victor, I think I want to start with you, and not just the reflections from Minister Lemke and all the examples that was mentioned, the state of the discourse, and the discourse is across a variety of stakeholders. We'll talk about those stakeholders. Based on your experience, where are we with that discourse today? What needs to drive that sense of urgency? If anything that we can hear from this event is that sense of urgency for us to collectively act, and act aggressively.
Thank you very much, David. And I thank the Summit for putting this session together. As you said, it's about action. I think the last session that Maria ran was very clear in making sure the urgency of the situation is well known. Someone said, we're preaching to the converted. Certainly in this audience, I think we now get it. This is big time problem. Public health crisis, equity crisis. The question is the rest of the world catching up to it? So the good news, of course, you know that we're getting more attention. COP28 devoting a whole day is a sign that things are going the right direction. But still, I think in my travels, I believe this issue is not as well known to the public and to policymakers. So you asked me about the discourse. My feeling is the last few years, we've got more and more momentum, if you will, around this area. But still, I think there are very few policy actions that's really looking per se in climate and health. So I want to maybe take a minute to describe a couple of things. First of all, you think about all these sectors that are impacting climate change: agriculture, transportation, energy, you name it. Every of these sectors, obviously we all know from their point of view, is carbon emission, energy consumption, what we need to mitigate, but rarely do they ever say, what does that mean to health, right? And in fact, there are very few policy decisions per se related from the sectors in terms of health, right? So I do think there's no question we didn't bring health into equation. You know, we're going to talk a little bit more about this, I'm sure. Agriculture, you know, from, more plant-rich diets, less meat, the waste that you see from cattle, what do you do with the methane emission? There are many issues. But in fact, if you do it right, you get better health, also much lower carbon emission. So I think they align. Transportation, you're going to hear some more about the fact I live in the city and I have to go and see a doctor and I have to drive there and I have to wait in the traffic. But also supply chain, where there's so much energy being consumed in terms of supply chain, transportation. Energy, I think someone said earlier that all the clinics have solar energy, right? And I'll talk a little bit about that as well, I'm sure the rest of this. So there's a lot of intersection that's absolutely needed. And I'll say later about what we're doing at the Academy and bring together all these sectors, look at a new model, new framework around health. Second issue, which is kind of mentioned, but maybe not as much known to everyone, is that we're actually a big emitter. I think the earlier session says 4.5% of global carbon emission is from the health sector. Well, it won't surprise you, I tell you, the US accounts for 25% of total health emission. So we're a big emitter, 8.5% of our own US emission. Now, how do we get there? Well, I mean, aside from the facilities and the equipment, there's a lot of waste, but in terms of disposables, go to an operating room, you see how much waste there is, right? Plastics, food, and anesthesia gas turns out to be big. So there's a lot of things to be done. So when you talk about policy, I'll make it short. One is, I think, there are two types of policy as I see it. One is policy of climate and health, city planning, urban, all that stuff. Second is a policy around our own sector, right? If you look at our own sector, I think there needs to be policy in saying, how much are we emitting of each of the health hospitals and systems? And how do we actually measure it? And how do we create policy to say you need to reduce it? Likewise, in the supply chain, there's a lot of need for this. After all, the response to Scope 3, 70% of the emission of the health sector. Now, in the United States, we have a security at the SEC, Security Exchange Commission. Let's begin to say we need to now to look at industries, measurement, disclosure, and possibly at some point we'll go forward with some policy. Last point. On the issue of health sector, I think there's got to be a global, and Maria, I'm so glad you're here, right? A global understanding of what we need to do everywhere. Recognizing, of course, that countries like ours emit more, but it still happens everywhere. How do you have a global measurement? I know that you work on indicators, whereby people begin to look at what's the right level of emission, and what is the expectation that we need to maintain a certain level. I'll stop here.
So we'll get into some of those actions and accountability, which I think is really very important as we move forward towards this progress. And this is where I want to pivot to you, Maria. You reminded us in this last couple of days of the progress that we've made, that you've made, coming from those 3 to 4 people at a COPE event many moons ago maybe, talking about the importance of health and to where we are. And I'd like to reflect, A, on what has led to the success, what has caught the attention of the rest of the world outside, not in silos space, but health.
Medical journal, and I was talking very openly, as I always do, and I think one of the sentences that they were more attracted about is when I told them that I don't know whether you realize that COP28 means that for 28 years, actually 30 years, we have been negotiating on climate change. And it's interesting to see that if climate change is one of the biggest problems we are facing as a society, not only for health, for the rest of the society, and it's taking us 30 years to solve it, maybe the sense of urgency is not there. So the idea is to make sure that health will be the one changing that sense of urgency. And that's why when Dr. Kumar this morning reminded us that the normal color of our lungs should be pink and not gray, when everybody should have the right to breathe clean air, when you don't need to have more malaria cases in places where you are already having, where we don't want to see again more epidemics of cholera, more outbreaks of cholera, that we thought that more or less we put it under control. When we think we have all the tools and interventions to make sure that altogether the environmental risk factors represent 25% of the global mortality. So it's not just the climate change. Climate change is exacerbating all of that, but the opportunity here is that we could reduce by 25% the global burden of diseases. If you add to that the cost that is represented for the health sector, for the society in general, I mean, the figures are so appealing that I am still asking myself why we don't have this sense of urgency. 7 million premature deaths caused by exposure to air pollution, and still not having the headlines of all the newspapers every single day, because this is really an incredible figure. So how we give this sense of urgency without paralyzing our society? Because the society needs to hear positive messages as well. If you give them very negative messages, they will paralyze and say, okay, we are all going to die, so let's die, and that's all, and enjoy the days we have in front of us. So the sense of urgency is affecting our health, is causing a terrible damage. We need all of those images. We need to see what is happening in Africa, the flooding, the extreme weather events everywhere, the wildfires. We need to use that, but at the same time, we need to tell people, this is what you have to do. Maybe not in that sense, as an order, but if you are an individual, you have a role. You have a role to influencing others, to recycle, to convince your politician, to use your vote, to use a bicycle instead of a car, maybe reduce your meat intake. I mean, there are plenty of things you can do as an individual. As a society, there are even more. As a medical community, as a health professional community at large, we have a critical role now. I think we need to lead those transformations. I don't want to keep our health community treating the cases and being prepared now to treat more malaria cases, more lung cancer caused by air pollution. Of course, we need to do that, but not without putting our nose as a health community in business that normally they were keeping us aside, like energy sector. And I think the energy colleagues are now more and more used to hear from us about the importance of this transition to clean sources of energy and how much is killing us if we don't accelerate the speed and the ambition. We need to decarbonize the health system. Fully agree, green in the health sector. And you can't imagine the rewarding movement that this is generating. I think it's because the health community was waiting for something extremely tangible, that you see, I'm contributing, I'm reducing the plastic use in my hospital, more cost-effective water and chemicals use, commuting at the hospital is now more environmentally friendly. It's generating such an incredible movement that I think this is one of the positive things that will keep this movement going and motivating. And of course, COP. We have finally this opportunity at COP28 of having a health day. That is already mobilizing people, but we cannot miss this opportunity. And we need to make sure that at COP, nobody will leave in COP saying, I didn't know. That's the first achievement. If we have all the negotiators at the COP, all the countries represented there to negotiating, understanding that, guys, what you are doing is impacting the health of the people. So you are not just negotiating the amount of greenhouse gases emission, you are negotiating the number of chronic respiratory diseases, lung cancer, name it, that we will be having as a society. Be aware of that. And don't just treat us as, well, the health sector as yet another sector. No, we are the ones bringing the health voice, and that's why the sense of urgency might need to come from there. The fact that we will infiltrating those negotiators, telling them that they are negotiating with human lives and not just with carbon emissions. We need to be successful in that, and on giving hope and action and documenting very well. Victor, you are helping us very much on that, and Alan, of course, on documenting the health benefits, the enormous health benefits that can be obtained if we take the right decisions on mitigation. That will be amazing. Al Gore, not Alan. Our Alan is unique. Al Gore was the one saying the inconvenient truth. Remember, he was talking about the apocalypse now. It was very much needed, but we need to transform now on the convenient truth and putting several together as a health community all together. What are the key strategic directions? And then the health community will be unstoppable.
Well, the positive messaging on that opposite end of the cost of inaction and showing the value of action, what that means for individuals' lives, as well as the economic benefits, certainly is a great case. And that's why I want to pivot to you, Ethel. It's great to have you here. Thank you. Because you come from a country in the world I know very well, in Brazil, and you've talked about, over the last 10 months, and integrating and even taking different language and terms purposely to demonstrate the importance of the intersection of environmental and health. It'd be great to understand what has worked well in elevating this issue in Brazil that is so important. I know the challenges before, and we'll talk a bit about that because that's the environment we're living in. We have to be realistic with the environment we're living in, particularly talked about information, but talk about what's worked well. Say within that image of that positive messages.
First of all, thank you very much to be here. So Brazil is doing in this 10 months a lot of effort to make this integration in our government. And right now we have an opportunity to work together with Minister of Health and Minister of Environment and Climate Change. As I told you, we have this new name, put climate change in the center of the other minister, led by Minister Marina. And we have two women work together to integrate this force in Brazil. And we are doing a lot of work with an interministerial committee to work together to bring all the government to put the priorities to the environment and what the environment impacting in each sector, like economy and others. And but we have a lot of challenges yet. We have the infectious disease problem. We still are facing a problem with airborne vectors, and we don't know what will happen, because right now, with the El Niño phenomenon, Brazil is hit by this impact, and we have in the north of Brazil, I don't know if you are familiar with the Amazonia region, but we have a very important river that called Rio Negro. It's like Black River in the translation. And we are facing a very severe drought, severe dry, and this has put a lot of community that lives in this area without safe water, without supplies, as all the supplies came by the river. And we cannot go to this community by other way. So it's a very challenging moment in Brazil right now. We didn't expect, we are not prepared for that. So we are, after COVID-19, we are talking very much about resilience. What is resilience of our health system? What is this? What it means? And yesterday, we have a very good conversation with Dr. Michael Ryan, saying what does resilience means? Because usually think that we need to build in more, to have more infrastructure. And I think a good example that he gave me is when you receive like a punch in your face, which the time that we will respond, you stand up and make something with this. It's more or less what we need to do with resilience. It's not about to build more, but your response for this. So we are learning this in Brazil right now, because we have this situation by El Niño in the north and another situation with flood in the south. So at the same time, so we are facing this. But I would like to bring another subject we are discussing in the morning about, mental health.
No, you too.
Mental health in this community and the infectious disease. There are some topics that we agree with us, that there is an impact. But there is one topic that we didn't put on the table, or on the floor, under the table, is the violence. Some communities, they suffer violence. Some communities have some people that decide who will take the water, who will not take the water, so in all over the place. So violence, it's not we don't have this connection when we say the health, the sustainable health challenge. Violence is not in our common sense. You always think that violence is a justice. It's in the Minister of Justice. It's not in health, but it's a problem. And with this topic of violence, I would like to make a very, I think in behalf of the Brazilian government, saying that I would like to put my voice with Dr. Tedros, saying this right moment, we are in the biggest World Health Summit, and we are not talking about what is happening in our old world right now. We have a violence that make people that are without water, without food, without electricity. We have our colleagues, doctor and nurse, that are facing a very difficult time because they don't know what they are doing with the patient in the field. So the violence affect all the health system and what will be our response. And I think it will be a very shame of us if you don't talk about this crisis right now, right here, because we are the community health in the world, united here, and you have to raise our voice to those that they can't. They are there, they are suffer, they are not responsible for that, but they have this, they take this punch in their face. and they have to respond. But we must need with WHO is stand up with WHO and say we need peace, we need to stop violence, we need to have the human rights for all, not for people that I like. It's for all. It's health for all, not for the one that we like. So I would like to say this message in behalf of Brazilian government, and I would like so much that everyone in this room stay with me for peace. Thank you.
Well, thank you, Ethel, for pivoting into the pace and taking a holistic perspective around the impact, in this case, of climate change and health. And we're reminded earlier in this week, in the youth voice that Maria, you brought out so nicely, about the impact of mental health. And that's why I want to come to you, Alan. Part of the messaging when we talk about the positive impacts is we need to have data. We need to understand the connections. We need to understand the downstream impacts that this has, that people talk, and rightfully so, in issues around lung health and clean air. What does it mean in terms of droughts? What does it mean in terms of people's environment? What does it mean more susceptibility to violence? Where are we in terms of that evidence? Where do we need to be able to go to inform the policies? Because countries like Brazil have to make choices. We all have limited resources. And going to the areas that are most impactful, and then being able to tell our story through real, tangible data that is going to be evolving over time. It's not a static environment. It needs to continue to evolve. Where are we in that process?
Fantastic. Thank you very much. And just to echo comments from colleagues on the panel, that it is fantastic how much focus there has been at this World Health Summit on climate change. And it's last year's summit was notable by the fact that it started with protesters saying there is not enough climate change being discussed at the summit. So it's wonderful to see that has been changed so dramatically this year. The evidence, so I'm from the Wellcome Trust. We are a research funder, and our focus is on human health. And we have 4 strategic areas that are discovery, infectious disease, mental health, and climate and health. And I'm very privileged to run our effort on climate and health. It's the evidence base on climate and health is unequal. And I'll come back to that because it's unequal in many ways, and I think it's a major problem. When we think about the links between climate change and health, we think about 3 different pathways: the direct pathway, that would be heat or extreme weather events; the ecosystem-mediated pathways, so that's things like the spread of infectious diseases, the ability to grow foods, the impact on mental health; and the socially mediated pathways, things like conflict, civil unrest, migration. All of those have enormous impacts on human health, but in very different ways and in very different parts of the world. The scientific community has been asking relevant questions for some time, but the way those questions have been asked and the distribution of the researchers is enormously unequal. We published a machine learning systematic review 2 years ago, which mapped, with colleagues here in Germany, actually funded by UK FCDO, but also working with Mercator here in Germany, a review which mapped all of the evidence published over the last 10 years or so on the links between climate change and health. And there are 2 very stark findings. Number 1 is that by far and away the vast majority of evidence is in Northern Europe, North America, and China. Mm-hmm. And there is almost no evidence on the links between climate change and health for Africa, Southeast Asia, South America. Almost none. Brazil actually being an example where there is plenty, but the rest of South America, it's a barren wasteland of evidence. The second thing we noticed is that the topics differ. So there's an awful lot of evidence on air pollution. There's an increasing amount of evidence on heat. But things like maternal and child health, things like mental health, totally absent from the evidence base. So it's the questions that are being asked and where they're being asked. So, and by whom. So at Wellcome, we're trying to address that directly. We're saying these are globally important questions that should be asked by researchers around the world, not just in Northern European and North American countries. We should be asking questions that are relevant to the communities that are most affected. That means working with communities to understand the impacts of climate change on health, understand the relevant threats, what they could be about water security, they could be about violence, they could be about mental health, they could be about air pollution or heat and other things. And then building the communities of researchers and policymakers locally to drive action. So a change in the way we're asking the research questions, a change in the way we're asking academics to think about research. The other notable thing is it's taking quite some time, colleagues in the room, for health people to understand the impacts of climate change. And part of that, of course, is that I will bet that there are not more than 10% of the people in this room who, during their medical training or their health training, were taught about climate change. So that is a failing. That is a failing of academia. That is a failing of research. That is a failing of global health institutes, because we're not training the current and future generations on the most important driver of human health. That is something clearly we also have to change. And that means that the communities are taking time, health communities. Now, of course, it's fantastic to have support from the global health community, but it's taking time for the health community, for public health institutes, for academia to respond to the need to develop this evidence base. Once the evidence base is there, then we are in a much better place, of course, to respond with evidence that is directly going to drive policy action. And that's the critical need. We must have locally based evidence to drive policy. But of course, we cannot wait, because the climate crisis is accelerating much faster than people thought. And the future is looking very grim. The climate scientists are very pessimistic about the future. And we must act, and we must recognize that is going to change. So an acceleration in the generation of research, urgency must be driven into research practice, and a responsibility of funders to increase the urgency and the speed with which we act, but also then the generation of that evidence that will allow policy action.
With limited time and limited resources, we need that direction, and we need that direction to be dynamic. We need a direction to represent the people, the world, and the needs that they have. And we'll pivot back to the issue of communities. But I want to move into the area of actions, and particularly, you hear a lot about stakeholders, you hear about collaboration, you hear about the importance of partnerships coming together. And Garth, many times people talk about the private sector. They talk about the private sector and its role. I'll talk about the private sector and the resources, its knowledge, and the like. And it'd be great as we start this conversation for you to be able to talk about your experience and how the private sector can galvanize many of the issues that you talked about here in this panel. I also want to remind people that you have a background in government, you have a background in academia, you have a focus on community health, and you also have a history in equity. So bringing those little pieces together may be a loaded question here for you, but it'd be great to understand, how do we take this forward and really act upon it with a shared set of values and goals, and not do it in a way that's siloed?
Sure. So I'll speak on a variety of different levels and try to make it short. The private sector, much like the components of the public sector, share a responsibility for the actions that are required to mitigate climate change at the macro level. And I think it's important for large private sector organizations to be able to not only vocalize, but deliver on the commitments that they make. And so, for instance, Google, of which I'm a part of, we articulate a lot about our commitments to the climate endeavor overall, but also looking at how we mitigate and utilize our business model appropriately. So, for instance, Google organizes the world's information. That's really the business that we're in terms of information sharing. And so how do we then direct and help billions of people across the world make decisions that are beneficial, not just for themselves, but for the climate? And so, for instance, a simple thing like your driving route. How do we deliver and educate people on an eco-friendly driving route and the kinds of decisions that you can make day to day that can be beneficial in general. So again, thinking through the onus of responsibility as a private sector player in general, but also understanding the business model as you're able to do that. And recently we talked a lot about how we help people make eco-friendly decisions around transportation, even macro things like understanding aviation travel and understanding the kinds of things that are can help that people, the kind of decisions people can make to mitigate their travel, to make appropriate decisions. So that's one aspect of understanding business model, private sector, being a part of the whole fight that we all are a part of, and it really is a battle in terms of mitigating the impact of climate change. But let me delve a little bit deeper, utilizing some of the different experiences that you just talked about in terms of understanding our role and responsibility. So my team, we work on health on YouTube. And one of the things that we are able to do is we give a voice to many of the different communities across the world that are articulating their viewpoints around climate, but also how do you educate people again on the kinds of decisions that they can make to help mitigate a lot of the challenges that we're facing now and in the future on climate change. But it's interesting to see those voices. It's interesting seeing the diversity of those voices. Dr. Adana from the UK and other younger, I think I can say younger, leaders who are leading this next generation around health equity, climate change, and really bringing together the culmination of those things. And it's important that those voices not only be heard, but help to educate the world around the kinds of things that both we can be doing as individuals and collectively in the healthcare system around climate change. One other interesting point in terms of those voices, and to go to your part about health equity, you know, some of our most impacted communities are some of the voices that we, some of the most voices that are least heard because they themselves don't have a voice. So how do we then amplify the messages of low-income communities across the world that are not only sharing this planet with us, but having a disproportionate burden of the impact of climate change from a health perspective. You know, I grew up right outside of Kingston, Jamaica, and I go home a lot. And when I see what's happening, not just with air quality in my community, but what's happening with water quality in where I'm from, and what's happening with food, and what's happening with all of these components of how climate is impacting my community on a day-to-day basis, it's important to understand just how connected we are in this ecosystem, but it's important to understand, again, how we help to amplify, share voices, and have a shared commitment. So I just close off by saying, you know, the private sector component of this is just as important as the public sector. It's important that we're all not only bonded, but have a shared vision in terms of how we get there. But it's also important for us to be able to elevate and have those voices of folks from a variety of different communities across the world be able to articulate not only their role in terms of what's happening around climate crisis across the world, but also what's needed from other components of the health sector and beyond.
Thank you for that, Garth. And I'd like to pivot to you, Victor, and talk about some of the examples tangibly where you are already bringing these stakeholders together under a common purpose. Have a framework. I know you've announced things from the National Academy of Medicine, even this last week, about those partnerships that go from the promise to the practical, and the practical to the roadmap, and how we move this forward, and the roadmap to the snowball effect that everybody needs to jump in here and participate in this. Can you talk about some examples here of how we take the action? Because I don't think we need to make the argument anymore. We need to figure out actually what to do next.
I was just going to say my fellow panelists make a really compelling case, particularly Attila and Maria, about how important this is, right? So, but this is about action. So I think it's really important, first of all, think about our own community and also outside of the community. In our community, I think earlier was said, we're the trusted profession, right? So, as you said, Alan, the really important issue is to communicate this issue to the public, to policymakers, that in fact this is a public health crisis. But in a way, which has been said by Maria and Nato, also positive message about what can be done and how would it make a difference, right? So communication is really important. So we've launched a major initiative at the National Academy of Medicine, which is called the Grand Challenge. Our whole idea is to say, let's take this on seriously. Let's mobilize everybody, because all these ideas need to be catalyzed by organizations, by leadership, etc. So that's what we did. And so we had 5 different actions. One is communication. No question that doctors, nurses, first of all, need to be educated. And in fact, one of our work is to look at, with the leadership of organizations that are responsible for medical education, nursing education, we're now changing US curriculum to look at that issue being a central part of this. But the ability to work with the private sector, people who are really good in communication, to work to get the message out. We can provide the content, but they can provide the delivery methods of messaging. Second, as we said, is decarbonize. Now, I'm not sure how many countries have their entire health sector saying, we need to decarbonize. For US, we're 8.5%. That's huge. Now, NHS has the green NHS. They are a single-payer system. So in our country, we took the job, working along with the White House, to look at how to decarbonize the entire US health sector. And so we've done this in terms of creating collaborative, not only about hospitals, clinics, but also supply chain. We have some of the big pharmaceutical device companies, you name it, all part of this. Just to give you an example, the co-chair of this initiative is myself, Assistant Secretary of Health, Rachel Levine, responsible for the Office of Climate Health and Equity, Sir Andrew Whitty, who's now running United, but used to be GSK, and George Barrett, who's a former Cardinal Health CEO, which is a big supply chain. So we work together as a public-private partnership to say, what do we need to decarbonize? And this is what I said earlier. First of all, we need to know how to measure these things. The second would be, of course, to find ways to begin mitigate. Important area, for example, I said about supply chain is that the entire supply chain has to think about very different ways of doing things. Pharmaceutical device companies, many of them have hundreds and thousands of supply chain distributors to look at things differently. But also, in my mind, with regards to the care delivery side, we're looking at how to change care altogether. For example, a lot more virtual care in the community where you don't have to think about transportation, but you actually at the same time not only reduce carbon emission, but improve health care by doing more prevention, things like that. Change the way you do your operating room, because the amount of waste is huge when we look at dispensables. From the idea of reducing infection to what's the evidence that you can do all this massive waste of things to food that we serve, to transportation, you name it, right? So that's another big one. I mentioned about working outside the health system, the need to work with all the other sectors, agriculture, energy, water, transportation, to bring them together under Judy Rodin, who's the previous chair of the Rockefeller Foundation president, working with us to bring, and Andy Haynes, to look at how do we have all the sectors talk together to put a health lens to this, and actually look at a new model, the economic model of individual sectors, look at framework of health of all the sectors, and therefore influencing policy decisions. The other one, of course, research innovation. Certainly, we work with Rockefeller, with the Wellcome, look at how do you do it in the United States and how to do it globally. And I think Alan's going to talk a lot about this. Equity, you're going to talk a little bit more about this. Working right in the community and low-income countries, and we'll talk about that. And finally, we have initiated a movement across the entire country using Don Berwick's approach when we look at patient safety quality. That is to say, anybody who wants to join can join. You don't have to measure it right, but once you join, you begin to have capacity, begin to measure and mobilize the entire U.S. health sector. Working with Joint Commission to do certification hospitals. Look at where they are. So there are lots of things we can do in actions. I think we want to be catalysts to do this, but I think in NHS and probably other countries, I'm sure in Brazil, you need this kind of catalytic action to really mobilize the entire biomedical community as well as working outside the community.
So pivoting from that topic, which really good examples there, and actually the value of a health-centric approach, that people can connect and understand the value of health, is really making sure we're elevating the voices that matter and use a bugaboo term, concept of trust, which is a hard issue in this day and age. And I want to ask you, Alan, you, Ethel, about this maybe from different perspectives. Alan, I know many of the initiatives that you purposely connect communities with policymakers, purposely connect to make sure that their voice and the solutions and the problems that we're dealing with reflect their needs. I suspect there's a lot of inherent trust that comes from that process, but it could also be difficult because there isn't necessarily a lot of trust when it talks about the broader group of policymakers. And I know, Ethel, hearing you talk about the importance of information and disinformation and how that is changing an environment that is very difficult, and we have to understand the broader environment in which we all live, and we're going to try to communicate. It's great to have the insights, but if people don't understand it and don't believe upon it and don't trust in the sources, then the examples, Victor, you're talking about aren't going to happen. Yeah. Right? So maybe, Alan, first you can talk about the learnings. How are you able to bring these groups together? Maybe a tangible example or two, and then tell us, how do you apply that in a case that is a very big, diverse, hard country that's also gone through some changes? Alan?
Fantastic. Really, really important question. I'm going to give some examples, and I'm actually going to start with an example from Brazil. I had great pleasure of meeting the minister earlier, and we talked about the CDAX project, which is a project in Brazil. It's a longitudinal study of 100 million Brazilians, and Wellcome will be supporting the inclusion of climate variables into that longitudinal study. It's a very interesting study because of its scale and because of its direct connection with the ministry and with the government. So you immediately have a direct route from the evidence to the policymakers and the policy stakeholders. It's going to be a hugely important learning facility and drive some really interesting innovation, I'm sure, in science. That's an example. Another example, I think all of these examples demonstrate Wellcome's ambition to ensure that the research that we fund is directly linked to the communities who are at risk. So 100 million Brazilians, of course, it's in Brazil, with local communities, understanding local health impacts, and now also including climate variables. But it's working with local communities to conduct high-quality research in collaboration, and then to generate the evidence which can be used and directly fed into policymakers. Another example is our work on dengue. So dengue is a very good example of a disease that's being spread. Increasingly, the distribution of dengue is changing because of climate change. And we're funding a major randomized control trial in the Mekong Delta, which will see whether or not an early warning system for dengue is better than the existing health system, warning system for dengue outbreaks. That's a fantastically important project because it's directly working with the Ministry of Health in Vietnam, in the Mekong Delta, in order to generate the evidence which can shape the national policy on dengue. Another great example, in Tanzania, we're working with a group that has been planting trees. Now, there are many people on the planet who don't think, well, there are a few key individuals who don't think planting trees is the answer, but there are lots of people who think that planting trees does provide some protection, but we don't actually know the evidence that tree planting has a major protective effect on health, especially in agricultural workers in hot countries like Tanzania. There is a major study in Tanzania working with local communities that have been planting trees for 30 years, and we're evaluating whether or not that is a way to adapt to the increasing temperatures in countries and amongst agricultural workers, for example. So all of these examples, and I could go on, this year alone we funded £120 million of research on the the intersection between climate change and health, putting Wellcome absolutely at the pinnacle, at the leading edge of funding in this area. So please, if you're interested in research in this area, please keep an eye on our website. We have regular calls, and we're very keen to have the world's greatest researchers coming to us. But this is just an example of how we're trying to drive a change in the generation of evidence which works at the intersection between health and climate, works with local communities, and works to deliver research that is useful immediately by local policymakers.
Well, it also provides a platform to develop that trust, which we know is really important because we see the downside of trust and what that means. And I was struck, Ethel, as you talked about the environment in which you're dealing with. And many of the solutions and challenges had nothing to do with health. It had everything to do with the environment. It had to do with the people you're communicating with. Talk about some of those challenges, and again, that way forward. We want to be positive and be driven and action-driven. And if there's any examples you can share, and how you can engage those communities, develop trust, demonstrate impact, but in a way that's sustainable, because we can't have just one-off cases where you have a great case, it's a small initiative that doesn't become scaled. Talk about the environment and the challenges and the way forward.
Okay. First, I would like to share your good example of Brazil, which is SEDAC's initiative, that you have all this information together in a very important institution that it's under Minister of Health, which is Fiocruz. And I would like to give another example with this misinformation, disinformation problem that we are facing in our world. And it's a good example, and we are working with Google in Brazil, because we are, in Brazil, we will launch on October 24 contingency plan for disinformation and misinformation, and vaccination was chosen as a case study. And we don't want to fight against the platform. We want that they work with us. And it was very interesting, because when you call then to the Brazilian government, as Google here I was explaining, we have a very good feedback. And if you were searching for any health problem in Brazil right now, the first page will be the Minister of Health page. So this is a collaboration that we did with Google in this contingency plan for fighting against disinformation and misinformation. And we are doing a lot of things. So all the institution or foundation that are working with us with put the truth, the good information, or information that was right, they will receive a certificate from the government that this is a partnership with the fight with this disinformation, misinformation. It's a very large contingency plan. It's only an example, but I cannot give a spoil because the government will launch next week. But I think it will be an example for other countries that we can do together to fight with this, because we need some understanding between us what we can the information that we need to spread. It's like the good information, but it's not what was happening right now in Brazil. And an example, I will come back with this crazy war, because we don't are in the war in Brazil, we don't nothing, but yesterday there's a people with a Israel flag that enter in the church and frighten people. He is not a Jewish, but so this is kind of information that are spread very fast and make people afraid, and it's very strange, and you need some regulation, you need some understanding between the big techs and the government, what we need to do in our countries. And the last example that I would like to say is we have in Brazil one professional that we call endemic control agents, and they are around 80,000 in Brazil, and they are spread in all municipalities. They have we have in Brazil more than 20 years, this professional that work. They are from the community. They have middle education. I forgot in English. I'm with the jet lag. And
Posso ajudar?
pode. Ensino médio. Ensino médio.
School at the medium level.
Yeah.
It's not high school.
Yeah, it's not high school. And they are spread in all of the municipality. And right now we are working with them with a new policy that they will be like a surveillance agent, not only endemic airborne vector agents, but will be like surveillance agent, work with environment. So this is like a new policy that we are working with them, and next year we'll be have almost 100,000 this professional in the field. So this we are very optimistic to building trust, because community already have this trust with this professional, and this is help us with this, because no one's after COVID-19 pandemic, what we are seeing is that trust between us is very broken, and it's not easy, and no one's want to be the index case. So we need to rebuild this trusting for the community to say, I have one problem if in my backyard I have an animal that dies, so we need the surveillance to have this, and we are trying to build this new policy in Brazil right now.
Well, it's a good and practical example of the challenges as well as a way forward, and that creativity, and remind people innovation is not a shiny object, it's how you actually solve a problem and set up a structure in which you can deal with it moving forward. And that connects us into the world of equity. When we talk about that issue, because many of those people you talked about, the frustrations they feel, the information, the flow, are those marginalized populations. And being able to rectify that, if we're going to really put equity at the center, we need to put it at the center with our actions. And I'd love, for Maria and Garth, from both of your perspectives and your backgrounds, and it's not just where you've come from and what you've done, it's what you've learned and seen. How do we really make this at the center? Because it's a great speech, it's a great thing to say, putting into practice and then measuring progress and making sure we have a nuanced approach in how we communicate. Language matters. I was taken by the language, Maria, by our youth ambassador, and the words that she used. They were different things that I heard. And I think it was important for us all to hear that language so we could learn how to communicate. So talk about the issue of equity and how do we take this forward and really establish it as a collective priority.
Thanks for the question. It's a difficult one. One of the things I am always terrified about not doing right is, in terms of communication, is to end up addressing only a certain elite of people already convinced about the importance of climate change, about changing our behavior, about the need to go on an electric car and be more vegetarian, and then being equipped on how to do these type of things. I think we need to target not only the elite, but definitely we need to target the medium and low class of people, for which we need to make sure that they understand the advantages of protecting the environment, because that will be the way of protecting their health. One of the rights that poor people or most vulnerable people will have is still the vote. I mean, if they, of course, if they use it and if they understand what they are voting, that is still a power that in democracy people have, and they should use that to put pressure on their governments. The second is that the only way, and I'm not a specialist on private sector, and definitely not a specialist on communication, but what I'm learning is that the best way to sell something is to have something positive that goes with. I mean, I suppose that some of those horrible drinks that we have sometimes contain a lot of sugar. This sugar is the one that gives people the reward that they are looking for. So what's the reward we are giving to somebody living outside London that needs to commute every hour, 2 hours every day, and then not having access to certain type of food that will be more environmentally friendly? So how can we pass that message to these people that air pollution is killing them, but it's not their fault? How can they escape air pollution if they live on a very polluted environment and they cannot escape from there? So this is the type, this is where it takes the responsibility to others, and this is what is motivating us to do even more with mayors. I think mayors these days are fantastic agents of change if they want to do it, of course. And maybe the reward we can give them is that we can measure and quantify the health benefits that they are generating when they are taking certain actions. And I think mayors love that because they depend very much on votes. So if we can quantify, if they promote sustainable transport, we can, as a health community, quantify the health benefits that this might bring, and then communicating that will be, of course, the sustainable transport system needs to benefit those of the medium and low income class that they need to commute to go to work. So focusing on interventions that will have a real impact in the daily life of these people who are not economically very high level, and then work with those who can take the decisions like mayors. The other thing I think is very rewarding as well, and we should accelerate, and that will bring benefits to the most vulnerable people, is accelerate the electrification with solar panels of healthcare facilities in Africa, for instance. Healthcare facilities and others. The price now of those solar panels and all the supplies that go with have dropped by 90%, they're telling us. So there is no reason why we cannot solarize. And that's a way to involve people who didn't cause climate change and they don't know how to react to that, empower them by having electricity, access to electricity, but an electricity that is clean, is green, and will not suffocate them, will not cause the problems, will reduce you know how many healthcare facilities around the world in very vulnerable countries are still running with diesel generators, diesel. I mean, not only because it's polluting, it's because it's expensive, and it makes you very vulnerable if the supplies are stopped. It makes you very, very much, you need to rely on that, and if you don't have diesel, you don't have electricity for your hospital. So we need to use solar much more, renewable energy much more. That will give some rewarding to the people, and that is maybe the way to start to measure benefits, and with those benefits convince and keep motivating others to do more on climate change and health. But only if we have something very concrete to sell and to demonstrate that is impacting people's life. And if we solarize healthcare facilities in Africa, that will be impacting people's life. Everyone, I mean, everyone, from maternal mortality to vaccination programs, neglected tropical diseases, name it, everyone will benefit. And I think this is an approach that we can take and pushing for this to happen, and then start to quantify the health benefits. I'm sure that we can put in place a fantastic monitoring system that will be very rewarding and generating much more action.
Yeah, the only thing I'll add is I'm just thinking of my own life experiences, and one of the challenges of marginalized communities is not being seen. And the challenge that many of the communities that I relate to, that I come from, is that they're just not seen, and their impact isn't seen, and their experiences aren't seen. And as climate change continues to evolve and affect their morbidity and mortality, that remains unseen as well. So one very important thing we need to do is to elevate their experiences, elevate their visibility, elevate their impact, and integrate that into not just conversations like these, but all the variety of different conversations that are happening both at local and global levels. And so I would just say one kind of simplistic strategy I would say is, in everything that we do, remember who's impacted and make sure that their voices are being heard.
Certainly a good lesson. Victor, I'll give you the last word on this issue before we open up the floor to questions.
Yeah, so I think everything's been said is spot on. I think, first of all, the equity issue, people want their voices to be heard, Garth, your point, and have a seat at the table, right? So I think Maria says it shouldn't be the elite. Absolutely. It should be everyone, and particularly those who live in socioeconomically more challenged circumstance in countries, in our country, in the communities of marginalized populations. So I think what you need is to give them a voice, a seat at the table, to be able to co-design and co-find solutions. So that's one. Second issue is what Alan talked about. Unless you have the information, you won't know what to intervene. So we, high level, know there's a lot of problems. But in fact, not collecting the data kind of gives you kind of gestalt without knowing where to intervene, what the issues are. So I think research and data collection is important. So we've done something called the Climate Community Network. As an example, obviously, this is only one example that can be done in many other places. First of all, you say, who are the ones that want to bring to the table? That's hard. So what we've done is did a heat map of the United States, looking at what are the communities and counties which have the highest climate impact. You can measure that. Also, match it with what are the counties with lowest income. And then matching those, we're able to bring together 20-some of these communities from throughout the United States, whether it's in Texas or Louisiana or in the West, Northwest, the Northeast, etc. But the other thing we did is we bring them together with the leadership. So that is to say EPA, HHS, Health and Human Services, state, really important, because lots of these decisions are made at the local level. Local governments, philanthropy, foundations, and academia, to look at how do we actually, what are your needs, and how do we actually address those needs? How do you co-design solutions? So identification of what our priorities are from the community is critically important. And then, of course, moving forward then, again, supporting what Alan's saying, you really need that information. If you don't collect, during COVID-19, we knew that a lot of people were not getting vaccines or treatments. But actually, the data was really difficult to get. Until we get them, we realize, oh, Asian Americans are different from Black Americans, etc. So you need that information. Race, ethnicity, income, where they live, where they work. That information is really helpful to make the intervention. So I totally support what you're doing. But you need to bring all these things together. Policymakers, community voices, data, research together. That is how you can get to make a difference at scale. So we're doing that in the United States, but I'm sure that there are other countries, and of course through WHO and others, you can do it really globally.
Let's open up the floor to questions. We're only going to have a chance to take one or two questions. I see a lot of hands here, and there's a lot of lights in my face. So there's a young person right here in the middle. She's got her hand right up, nice and tall there.
Lots of hands.
Right, go right back. It looks like maybe the fifth row there. There you go.
Thank you. Hi, I'm Mustea from the International Youth Health Organization. So firstly, thank you for an interesting and inspiring session. And my question is, how can we, as young people, contribute to sustainable health, and how can we influence governments and policymakers to take actions regarding sustainable health strategy creation? Thank you.
Who wants to take that on with a quick answer?
Yeah, no, I'll take that on because it goes back to the points I was trying to make about voices. You know, some of the most amazing creative voices I'm seeing are coming from younger people. I was going to say young people, that's going to age me. But it's coming from folks that are even very young because they're able to articulate the responsibility for just not now, but in the future. So I would say that, you know, continuing to kind of mobilize and make your voice being heard is particularly important. engaging in all of the various conversations that happen, not just the conversations that may happen amongst yourselves, which are motivational and can happen in small groups, happen in social media, can happen in other places, but then engaging in some of the most formalized conceptual policy-making conversations and being proactive about and understanding where they're occurring and showing up and being a part of them. But I'll just say, I have been impressed globally by the voices of young people. And I think, quite frankly, just being very transparent, it's put to shame a lot of older folks, myself and others, who have not been as vocal and as articulate as I've seen a lot of younger voices in the last couple of years.
All right, you sparked interest with our panel. They all want to go through and have quick answers to it. Maria, you wanted to address that?
Just very quickly, definitely we need you on the sustainable health systems very much. Join Attach, and we will connect you to that, and I'm sure that you will be supporting, but lead by example as well. You are maybe today a medical student, and one day you will be working on a hospital. Make sure when you go to certain hospitals now, you see the youth going by bicycle, the old doctors may be using a more traditional way of transport. Sometimes it's not true, but and then they will reduce the plastic use, they will be very sensitive to that, they will talk to others and try to engage. It's always a pleasure when we see in different health institutions, when you have a young voice mobilizing the whole community, putting in place some initiatives, some ideas. So leading by example, be creative, protest, engage, and demonstrate if needed, and go for a white coat revolution. Definitely.
Alan, you want to talk, and again, the protest will come very quickly. I have more questions here.
Just really a very quick. I think that there are lots of ways that we do things. We've always done it this way. And I think the role of youth is to say why we're doing it that way. That is bonkers. Yeah? And when I was an academic, I had a fantastic young team, and I said, well, we do it this way. And they said, no, Alan, let's do it another way. And that way has got to be a way that leads us into the future, and you're more than capable of sorting that out.
Okay.
I would say also engage in research, because we've used in our last initiative I told you about, we're using youth to collect information in the community. Trusted, being able to learn how to use that information. We use photo voice, having them to look at narratives and pictures as well as information. I think that's a really important way, aside being activists, which is important, having that information behind it and learning how to use that information. So get involved with research as well.
All right, see a gentleman, he's wearing a tie here. This is very nice, maybe, right here in front. There you go.
Thank you very much. Renzo Ginto, I'm leading a pra-academic organization working on building climate resilient health systems in the Philippines. And I want to ask this question to the panel. This is, I think, the 7th panel on climate and health, Planetary Health, One Health at the World Health Summit. And everybody has been saying we need community voices. Where are the community voices in this panel, in this room, in this summit? We've heard a while ago from Victor, there's little progress at the national level. It's community organizations that will influence ministries of health, because WHO cannot do it alone. Alan said, we can't wait for evidence to act. The community organizations will act at the local level even when evidence does not exist. They will even collect the evidence without a welcome trust grant. And I've been hearing a lot in this conference, we need to break the silos. There are no silos at the community level, because the climate organization is the health organization, is the food organization working with the communities. And this morning I heard, there's climate financing available. I'm worried that 4 of my staff will not be kept in my payroll next year. I even have to fund my travel here to Berlin. I have to beg one foundation for a registration slot to be able to attend this conference. I'm sure some of your organizations have already budgeted for COP28 or even for the next World Health Summit. So I think we really need to walk the talk. If we really want to center the communities We need to make sure the funding goes to the communities. We need to make sure the support is available to the community organizations, the social entrepreneurs that will make all these aspirations happen on the ground. And I know everybody is saying we need to close this panel with a glimmer of hope. Yesterday I was brainstorming, dreaming with Omnia El Omrani. Omnia and I started in climate and health advocacy by doing it. We didn't go to a school to study climate and health. And we are dreaming about establishing a global academy for next generation climate and health champions and social entrepreneurs. I think that's something Wellcome should be funding, and Sanofi, and Germany. I think YouTube Health should help us multiply by 100 times our reach. And WHO, we need your support. And I think if we realize all of these, if we really invest in people working in the climate front lines, in 2 years' time, WH's 2025, this panel will look totally different from what we have now. Thank you.
Anybody want to address that?
Totally agree.
It's a tough question.
I'm totally agree with you. I'm totally agree with you. I just say for Brazilian side, we are, for the first time, we are funding the civil society. So we have a grant for this. This is new for us. And because we totally agree with you, without money, we cannot, it's very hard for the civil society to mobilize, to be present, to have their voice. And I think you are very brave and courageous, and I think you close in a very good way, because and this is intergeneration is very good, because you teach us a very good lesson that we need to learn and to make a different panel in the next year. So thank you very much for teaching us this, for teach me at least.
And maybe that's the close here of the panel. Raising that voice, wherever it may be, is really very critical, and the recommendations that you had, wherever you may come, and hearing that voice is important. I want to thank our panelists for their time here today. Part of the challenge is showing up, so I appreciate you coming here and taking the time. Thank you so much.
Thank you.